Hi guys, so this is what I refer to as bucket two. And bucket two has to do with medical care and just kind of a medical review of the clinic in general. And so what we're looking at with bucket two is what animals are not currently being treated or saved, quality of care, consistency of care, and then of course, outbreak management. And outbreak management really is becoming increasingly important because of transports that are happening across the country during the pandemic. We really kind of opened up or cracked open the need that we knew already existed, but of animals needing to move north to have those live outcomes. And so this is going to be important to everyone, not just necessarily the shelters in the southern part of the states, which was kind of previously the case. So what is not being treated or saved? So there's typically groups of animals that are not being treated, saved, or are really difficult to treat or save, meaning they're taking up a lot of the organization's resources and time, staff, space to treat these animals, all of those things. And so if we can streamline those processes, make them more efficient, make them possible to execute, then we can start saving or better saving those animals. And so common groups of animals are going to be senior cats, feral cats, ringworm, whether it's cats or dogs, neonate animals, parvo dogs, panloop cats, disease and FELV or FIV, and then just other medical, whether it's hit by car, what we commonly refer to, or what I commonly refer to as crappy cats. They're have poor coat, they're thin, they're maybe not eating, they're senior, can't really pinpoint exactly what's going on with them, but they don't look healthy. And so the first thing that I would recommend, if you have a group of animal that you are trying to improve in how you're saving them and treating them, or start saving them in some capacity, even in a small capacity, is do your research and really find out what exactly is needed to care for these animals. And I have on here multiple sources because I want you to look at many, many websites from different organizations to really kind of get a good base knowledge of what is required, because you're going to have some sources, they're going to tell you, you have to have gold standard, you have to do routine blood work, you have to do lots of things to save these animals. And then you're going to have some organizations that are going to say, kind of probably what American Pet Supply would say, is that you don't necessarily need all of those things, but here's the minimum that you need to have in place to start saving these animals. And so go to different sources, different websites, different universities, different national organizations, talk to other organizations that are currently saving these animals, whether they're well known or not. If there's a shelter or a rescue in your area that is doing a really good job treating ringworm cats, then maybe give them a phone call and say, hey, what are you guys doing, how are you doing it, and learn from them. So start learning and learn as much as possible. So you want to create your own best practice based on the information, because there are going to be themes in these different groups of animals that you do need to have in place, and you don't want to cut corners where it could cause problems for either the animals themselves or the people treating them or the shelter. And so come up with something that your organization can provide, but make sure that you're meeting all of those minimum requirements and doing a good job. And then find out what they need and provide it. So once you have an idea of what this group of animal needs, find out how to get it to them. Is it by recruiting volunteers? Do we need to start asking for donated medications? And then kind of start building your program from that information. It typically doesn't take a lot in a lot of cases. You can start really small, start by saving one or two of those types of animals. Start a small program, start a pilot program, just start somewhere. And you don't need gold standard. You are going to need certain things in whatever type of animal you want to save, but it doesn't necessarily need to cost a ton of money or require a ton of staff time. You have to kind of modify all that information that you research to find out what you guys can provide. And I have an example here This is, I was talking earlier about our crappy cats. Oh no. And this is a sample protocol of something that we have created to address these cats, because we get a lot of these cats a year. We get probably, I don't know, I would venture to say hundreds. And so it's not really realistic for us to treat each of these cats in a new way, right? It's like a vet, the cat comes in and a vet makes a new plan each time these cats come in. That's just not realistic for us. But they have probably all of these same symptoms. And so what we did was created a flow for these cats that doesn't cost a lot of money. There's not a lot of expensive diagnostics involved with this, but it's going to treat for all of our top differentials. And then once we have run through this flow chart, this algorithm, then if whatever, we're still not treating what we need to be treating, then the vets can make a different plan. But it's pretty straightforward. Again, we're using, you know, specific gravity, azo sticks, stuff that doesn't cost a lot of money, but it's really effective diagnostics and results that we need to know. Figure out how to get back to where I was. Okay, so that's just an example, and that's going to be, I believe that's in your resources tab. If it's not, I will email it to you, but it's a really good example of a group of cats that we were having trouble keeping up with saving. It's taking up a lot of our vet time, a lot of our staff time and treatments. And they just kept coming through the door. And so we kind of figured out, what do they need? How do we get it to them without costing us a ton of money or a ton of staff time? All right, and then so quality of care is the next section. So quality of care has nothing to do with gold standard care, absolutely nothing. You have gold standard care and then you have quality of care. And just because you're doing gold standard care doesn't always mean that you have a really good quality of care. And so to me, this means that every animal is being vaccinated appropriately. If you're vaccinating on intake, maybe you are intaking so many animals a day that they're not all getting vaccinated on intake. They're having to wait. That's not good. That's a poor quality of care. I would say, are they getting their medications on time and appropriately? You know, are you not always getting to the twice a day medications? Are they missing doses because staff time is stretched really thin or resources are stretched really thin? Are they being fed appropriately? If you have, you know, young kittens, are we making sure that they're getting food that they can eat? You know, they're getting gruel, they're getting mush food. They're not just getting the kibble in their kennel that is really hard for them physically to eat. Are they being cleaned up after? Are illnesses being identified quickly and then treatment started? That's a big one for me. It drives me a little crazy to see animals waiting to get an exam because they're sick, but because of the volume or because of whatever reason, they're having to wait. We want animals to get illnesses to be identified quickly and then treatment started. And the best way to do this is protocols. And we'll talk extensively about that. But protocols that tech staff, trained staff can start, get animals moving in the right direction is going to be incredibly important. And then just basic needs. You know, are we making sure that, again, feeding, cleaning, they're getting some sort of care and attention. We're not neglecting them in kennels. And then a couple ways to improve, some tips and tricks are once a day meds as often as possible. If we can medicate once a day versus twice a day, that saves a lot of staff time. So we do, for example, all of our carprofen is going to be once a day. We do metronidazole once a day. As many meds that we can do once a day, we do them once a day. Because again, that's just a lot of staff time devoted to twice a day medications. Have protocols for the most common, because this is going to also lead to consistency of care. Once everybody starts to know what the process is, then that process, the quality improves. People know what to expect. So many reasons for protocols, but it's going to be one of the quickest, easiest ways to improve not only quality of care, but consistency also. Use volunteers. Volunteers can help, you know, hand out meatballs, medicated meatballs to dogs. Volunteers can help clean and feed any animals, hospitalized or not. So really get creative about how you can use volunteers. And then educate, educate, educate. The more everyone knows, the better. Every staff person should know what a vaccine on intake is. We want them to know what common medications are used for. We want them to be aware of our protocols, because that's just going to overall lead to better quality of care rather than just medical staff holding all of this information. And then, so you can't really see the bottom maybe, but you want to automate accountability. If for some reason medications aren't being given, for whatever reason, animals aren't being cleaned or fed in a timely manner, you want to be able to hold people accountable without just being over their shoulder constantly. And so automating that accountability through checklists, through treatment sheets, is going to be really helpful. That will increase your quality of care. And so consistency of care, again, protocols, I cannot stress the importance and helpfulness of protocols, because again, that's just going to lead to consistency. People will start to get in a routine of just knowing what to do, when to do it, and that helps everybody. And then also we talk about this in the protocol section, but when people know what to expect, they feel more comfortable in what is going on around them. So having that expectation is important. Document treatment limitations. So that means that if you have, if you see a lot of, well, maybe not a lot, but if you see, let's say, cats with chronic renal disease, how do you treat those cats? What do you do for end-of-life care? Do you do anything for end-of-life care? And so I'm going to show you this example of what that looks like. So this is congestive heart failure. We also have one for chronic renal disease. But for animals that have congestive heart failure, what are our limitations? We can't afford to send animals to cardiologists. We can't afford to do a lot of extensive testing. And so this outlines what we can do for these patients, and when and how we do it. And so it goes back to consistency. All of our patients are being treated consistently. We're not favoring by accident one over the other. And again, everybody knows what to expect. Kind of a rule of thumb is if you can't do it for all of them, you really shouldn't do it for one of them, or find out a way to do it for all of them if you want to. If you want every cat that has a dental to get a Convenia and 2 Bupasar injections after surgery, then make sure every cat gets it, and find it. If it's too expensive, find a way for every cat to get it. Talk to development, cut costs in other places. But it's not really fair to do it for some cats and not for all of the cats. So that's kind of what I mean when if you can't do it for all of them, you shouldn't do it for one. Of course, there's always going to be some exceptions. We don't want to just make everything so black and white, because that's just not how our work works. But if you want to put something in a protocol, you want, every cat to get that Convenia or that Cerenia at a certain time, then find out a way to make sure that they can all get it. And keep it objective. I know it can be hard. Everybody has their favorites, and everybody has those animals that really pull at their heartstrings, and you want to go the extra mile for them. But for the sake of the entire population, you want to make sure that you're making objective decisions about care and about patients, and it's not subjective. And then staff should have a routine that benefits the animals. If you're consistently busy in the evening, then make sure the bulk of your staff is available in the evening. For example, for a really long time, we fought for, or our staff wanted to maybe have like some shorter days. We work long shifts, less days a week, but it's nice to get out at 4 o'clock every once in a while. And I agree with that. But when we do that, we lose a lot of communication. There's just a lag, and there's a gap in care that happens because one person or multiple people leave, new people start, and are kind of at a loss as to what went on that morning. And so that doesn't benefit the animals. And so we aren't able to provide that. We can help out staff and give them some perks in other ways, but that's not necessarily going to be one of those ways. So a routine that benefits the animals always. And then, so disease management. So again, this is something that's becoming increasingly important for every rescue and organization to be aware of, especially as we're transporting more. Precautions are being taken, or hopefully are being taken before animals are transported out, but we can't predict everything that's going to happen. And so having standard operating procedures and protocols that work to prevent outbreaks is incredibly important. And so that goes back to your vaccination protocols. You want to make sure that you have effective vaccination protocols. Your on-site housing is going to be in a manner that leads to healthy animals. Cleaning protocols. So I have a little puppy in my office. And then appropriate PPE where needed. One thing that I see often is shelters will have a parvo treatment ward, and they're using gowns and gloves, but they're walking in and out with their own shoes. And so they are potentially tracking parvo in and out. So thinking about your PPE and using it wisely. Some tips and tricks, info sheets and waivers. So when in the face of disease and illness, the goal is for animals to leave the shelter, because that's going to stop continued exposure to whatever disease we're trying to prevent if we can get that animal out of the shelter. And animals recover quicker in a foster home. And so we want animals to leave into foster or even get adopted if possible. So use information sheets, waivers. We've created waivers for Calisi exposed, Panleuk exposed, Parvo exposed, you name it. They're healthy right now. They likely are not going to get sick, but we need people to understand that they have potentially been exposed. We want to give them all of the information before they take that pet home. Inform them, but don't scare them in these info sheets and waivers. You want to be very honest, be informative, but not scare them to the point where they're not going to want to take that pet home. So be smart about how you're talking about it, how your staff are talking about it, and how that's being received by the other people. And then explain why you need their help. Why does this parvo exposed puppy need to go to a foster home? Why does this Calisi exposed cat need to can be cleared for adoption? Let them know the why behind it. And again, the goal is to get them out of the shelter, so you're stopping that continual exposure to whatever disease, and or animals are going to recover quicker in a home, and not necessarily in our facilities. All right, thanks guys. We will see you soon.